Welcome to the Maternity Mentor. Today we will be talking about postpartum anxiety, the symptoms to look out for, and treatment options to get you feeling like yourself faster. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Between marketing of baby products to education in birthing centers or hospitals being focused on infant safety, including preventing sudden infant death syndrome or SIDS, many mothers are left feeling anxious and scared. When that anxiety becomes persistent worry and dread, that may mean postpartum anxiety is present. Let's explore what the symptoms of postpartum anxiety are and how to treat them. Postpartum anxiety is a different condition from postpartum depression. They can exist separately or together. Postpartum anxiety can also be called perinatal anxiety. Perinatal means before and after birth. Postpartum anxiety affects 10% of new mothers. Anxiety for many people can be normal and protective. Postpartum anxiety is a condition where the anxiety becomes disruptive to normal daily life. It can inhibit you from properly healing and bonding with your baby. Postpartum anxiety shares some of the same symptoms as postpartum depression. The most common symptom shared by both is feeling tired all the time. Other symptoms of postpartum anxiety include excessive worry, lack of concentration, feelings of dread, racing thoughts, dizziness, shakiness or trembling, rapid heartbeat, changes in appetite either increased or decreased, changes in sleep either too much or too little, inability to sit still, hot flashes, sweating, hyperventilation, and nausea or vomiting. Most women will start to experience postpartum anxiety between birth and their baby's first birthday. However, up to 35% of women will start to experience symptoms of postpartum anxiety during pregnancy, thus the name perinatal anxiety. The rapid hormone shift that happens after birth has been indicated as a potential trigger for postpartum anxiety. However, this is not the definitive cause of postpartum anxiety. In fact, it's probably just a contributing factor. There are many identified risk factors associated with postpartum anxiety. These include history of an eating disorder, history of mood disorders associated with your period, history of depression, personal history of postpartum anxiety or family members with a history of postpartum anxiety, personal history of obsessive compulsive disorder or family members with a history of obsessive compulsive disorder, and previous history of miscarriage or stillbirth. Some studies have shown that history of miscarriage or stillbirth equates to a higher probability of developing postpartum anxiety. This increased risk is probably because mothers are worried something bad will happen, because something bad has happened in the past. Women with sensitive personalities may also be at risk for postpartum anxiety. Before we continue, please remember to hit that like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about the diagnosis of postpartum anxiety. If you suspect you have postpartum anxiety, it's important to reach out to your healthcare provider for diagnosis. Your provider may start by asking you to fill out some screening forms for depression and anxiety. Symptoms of depression are very similar to anxiety, and it should be ruled out. In addition to screening tools, your provider will probably order some lab work. Thyroid tests are very important because thyroid problems can also mimic anxiety. Your provider will also try to rule out anemia and electrolyte imbalances. If your lab work is abnormal, correcting these issues may help resolve your postpartum anxiety. If you do receive the diagnosis of postpartum anxiety, it is important to start treatment as soon as possible. Treatment starts with cognitive behavioral therapy. This is a form of structured therapy that works on changing negative or destructive patterns of thought. It focuses on developing behaviors that will help cope with the anxiety and the associated thoughts that go with it. Cognitive behavioral therapy helps assist someone with being able to think rationally instead of emotionally. Additionally, most women will benefit from just being able to speak with someone about what's going on and how they feel. Sometimes even just having some me time and a break from the baby significantly helps. Other effective treatments for postpartum anxiety include mind-body solutions such as yoga, meditation, progressive muscle relaxation, acupuncture, massage, and exercise. One study showed a 40 to 60% reduction in anxiety after 6 weeks of aerobic exercise or resistance training. Your healthcare provider may also recommend certain supplements or vitamins to help correct imbalances found on your lab work that may be contributing to your anxiety. For more severe forms of postpartum anxiety, your provider may recommend that you start taking an antidepressant, because most antidepressants are very effective for anxiety as well. Antidepressants are very safe and many can be used during pregnancy and breastfeeding. For more information on taking antidepressants during pregnancy and breastfeeding, please see our video on this. We will link that in the description below. Postpartum anxiety can also be accompanied by postpartum panic disorder. Panic attacks are feelings of severe anxiety that often come out of nowhere. Symptoms of a panic attack include chest pain, dizziness, a racing heart, claustrophobia, numbness or tingling in the arms and legs, shortness of breath or feeling unable to breathe, sensations of choking, and intense fear of dying or feeling like your baby may die. These attacks will often cause you to freeze and be unable to do anything. They usually last for 1 minute or less, but that can feel like an eternity during the attack. With effective treatment for postpartum anxiety, it may be able to help lessen and possibly even eliminate panic attacks from happening. Postpartum anxiety can be a very difficult condition to live with. I hope this has explained how to identify the symptoms of postpartum anxiety and the need to seek treatment so you can start to feel better. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.